What's up, guys? It's Lisa from Strength Foundation. This is your study guide for Chapter 2 for the NSCA CPT exam. This will accompany the Chapter 2 review video already posted. Today we're going to talk about the structure and function of the cardio respiratory system. More specifically, the things you need to put a little extra study time on to succeed in this exam. This chapter covers a lot. If you get through the early chapters on anatomy and physiology, it gets a lot more fun to get into exercise and gym design and all that sort of stuff, but you got to get through these. So go over your cardiovascular anatomy, understand atria and ventricles, understand that the heart has 4 chambers. Blood composition. Know that whole blood is roughly 55% plasma, 45% red cells, also called erythrocytes, and less than 1% white cells. The resting pH is 7.4, a normal blood pH is 7.35 to 7.45, and deviations are dangerous. Oxygen is made by hemoglobin, an iron-containing protein, in the red cells. So, go over this section on oxygen transport, but important, know that hemoglobin will carry the oxygen that binds to the red cells. Know that. Go over the rest of the things here, but make sure you know that very first part. So, you get into cardiac morphology, again, understanding the basic anatomy. 4 chambers, right and left atria, right and left ventricle. Understand that cardiac muscle is involuntary and has its own internal pacemaker. This diagram with the nodes will get into that. You'll want to go over electrical conduction. Know that the electrical impulse starts at the SA node, travels to the AV node, through the bundle branches to the Purkinje fibers, which trigger ventricular contraction. I know that could sound confusing, but if you go over it and memorize the order, if you get a question on that, you'll be good to go. Here is a diagram showing directions of blood through the heart. Know that an EKG, something the medics use or the doctor in the hospital, measures electrical activity of the heart. The P wave is atrial depolarization. That's when it fires. The QRS complex is ventricular depolarization. That's the spike. The T wave is repolarization. What does this mean? Repolarization is it's getting itself back together. Resetting, essentially. So you can see here the positive spike in the QRS complex. The heart is a pump, and it has an electrical system. Know and understand this. Get into circulation and the cardiac cycle. Blood flow. Arteries carry blood away from the heart, veins return it. Arteries have oxygenated blood most of the time, veins do not. Veins use a one-way valve and a muscle pump, where contracting skeletal muscles, your major muscles, squeeze the veins to help push blood back to the heart. Go over the definitions for cardiac output and stroke volume, but more importantly, understand the basics of the cardiac cycle. The heart has autonomic control. The parasympathetic nervous system keeps the heart rate low and at rest. The sympathetic system increases it during exercise. Know systolic blood pressure is the pressure during contraction, and diastolic is the pressure during relaxation. Systolic is the top number if you're talking about 120/80, and diastolic is the bottom. That would be 80. So cardiac output is the amount of blood pumped per minute, calculated as stroke volume times heart rate. Starling's law or Starling's principle states, the more the left ventricle is stretched, the more forcefully it contracts, increasing the volume of blood ejected. Think of it like a stretch reflex. Okay. The respiratory system, go over the basic anatomy. Function and structure. The primary role is the exchange of oxygen and CO2. Air travels through the trachea and bronchi, ending at the alveoli, which are the sites of gas exchange. Breathing in, or inspiration, is active, involving the diaphragm and external intercostals. Those are muscles between your ribs. Expiration at rest is passive, and these muscles relax. No basic terms for lung volumes. So, understand tidal volume is the air moved during normal breathing. Vital capacity is the maximum air you can exhale after a deep breath. Residual volume is what's left after all of that when you've had a maximal exhalation. So, leftover air in the lungs after maximal exhalation. We'll get into gas exchange or oxygen uptake. This part is a lot. Go over it a few times, use highlighting and flashcards if needed. The Fick equation. VO2 is the product of cardiac output and the arteriovenous oxygen difference, which measures how much oxygen the muscles are actually extracting from the blood. VO2 max you'll hear a lot in sports, gym, and training, the gold standard for aerobic fitness. It represents the body's maximal ability to take up, transport, and use oxygen. Here's some pictures to help represent gas exchange. So everything I just said about the Fick principle and oxygen uptake is more like elaborated upon here. And then lastly, training adaptations. Aerobic training increases VO2 max. That's the key of all of this, by improving stroke volume. So if there's a question asking, how does aerobic training increase VO2 max? It improves stroke volume and increases the density of capillaries and mitochondria in the muscles. Here is your study questions. So, I hope this helped at all. Basic anatomy of the heart, 4 chambers. Systolic and diastolic. pH. Basic terms like tidal volume and residual capacity in the lungs. There you go. Thank you for watching. This is Lisa from Strength Foundation. Comment your questions, what you're stuck on for your other chapters, or this chapter below.